A canine illness which shut down the Prince George's Animal Shelter has been identified as Strep Zoo. There is no vaccine for this bacterial infection. There are also very few warning signs before it can become severe. I am joined now by veterinarian Dr. Eric Cryan and the owner of Nova Mobile Vet. I love that you brought a guest with you tonight.
Yeah, I don't know how long Tiger's going to stay for this interview here, but yeah, I figured we'd see if he lasts a little bit.
Well, we appreciate both of you. Listen, Doctor, the county animal shelter let us know today that 30 dogs have died from this bacteria. It's very contagious, obviously tragic and alarming. What exactly is Strep Zoo, and what are the symptoms or signs to look out for?
Excellent question. Strep Zoo epidemicus is generally a common bacteria that's on horses, cows, pigs. It can cause problems, but most of the time it's just a commensurate organism that kind of hangs around. And if they're immunocompromised and sick, then it can cause issues in horses and the like. With dogs, unfortunately, they generally aren't, too susceptible. But if they're in a high stressed, high contact area, unfortunately, that's why we're seeing it spread. And unfortunately, it can be very contagious and deadly with dogs once it kind of gets hold in a tight quarters where animals are stressed and immunocompromised. The clinical signs can vary. It can be kind of a mild, non-productive cough that doesn't respond to the typical course of antibiotics. Sometimes it can be more of a bronchitis or a walking type of pneumonia, they would call it in people, where a pneumonia lasts for a while and doesn't resolve with a typical course of meds and antibiotics. So you are correct. There is no current vaccine for this type of virus. So we are, want to keep the dogs vaccinated for what they can be. You can vaccinate them for canine Bordetella. The distemper vaccine will protect against parainfluenza and adenovirus, two other components of respiratory virus. And the big thing that hit us last year was the canine influenza, virus. And so the CIV and those other two vaccines are very important, especially if you're going to bring your dog to a high contact area, boarding facility, grooming, dog parks, that sort of thing. During this time of year with things spreading, a lot of people are going to err on the side of caution and try to avoid those places if they can. But obviously, sometimes you can if you got to travel and things like that.
So the shelter says it's all hands on deck right now as they deal with this situation. They contain the outbreak. I guess bottom line, should dog owners be concerned? Is there a way to protect against this? I know you talked about no vaccine, but as long as their dogs are maybe up to date with their shots, including the canine influenza shot, is it at least unlikely to contract this disease? How concerned should people be?
If your dog is healthy and they're boarding at a facility that's clean and quickly recognizes clinical signs in dogs when they occur and takes the necessary steps, odds are you got nothing to worry about. So again, you want to keep your dogs updated with their vaccines, the Bordetella, the canine influenza vaccine, the distemper component has the parainfluenza, and adenovirus can have respiratory components as well. And a lot of these are kind of respiratory syndromes that dogs get this time of year, where they're part virus, part bacteria. But in the case of the shelter, yeah, that Strep Zoo epidemicus, that Strep Zoo, unfortunately was very contagious and very deadly, and affected those dogs, quickly. Yeah. And so some dogs, will have the lingering, and some will get exposed to this and quickly develop a severe pneumonia that's not responsive. They need intensive supportive care, and sometimes even with this, this unfortunately can be fatal.
Yeah. I know you don't know all the details about this shelter. I think they're still trying to figure it out themselves. But how could it have gotten there if this is more common in horses? I mean, I know a lot of these dogs are coming in with pre-existing illnesses, malnourished, so I guess you never know what they're coming in with.
Exactly. We don't know if some of these dogs from the shelter were at a place where, apologize, my dog's running around, were at a place where, they were in a more farm type environment and got it picked up. Or sometimes dogs can kind of have this, organisms not causing a problem, and then they get stressed, and then it comes out and causes infections and, respiratory signs and things like that. So it's, certainly possible that, a dog was at a farm type environment and got exposed to it from a horse or a cattle or a pig or that sort of thing, and wandered off and ended up in the shelter. Or it could be just a dog was a subclinical carrier of this, and then started spreading it in that high intensity stressful environment where a lot of, fortunately, shelter dogs are immunocompromised and stressed from coming from rough life on the streets, and not the best to have an immune system to fight off this pathogen.
Yeah, so really quickly, we have 20 seconds here. If someone's concerned that they might have Strep Zoo or have been exposed, what should they do?
Contact your veterinarian. Be up to date on vaccines. Have the veterinarian take a look, him or her take a look at it. Listen to the lungs. Make sure there's no signs of pneumonia. The big thing, if the animal's clinically sick, lethargic, not eating, acting punky, not acting like your normal fur kid, you definitely want to err on the side of caution. Get them checked out at your local veterinarian.
Dr. Eric Cryan, we appreciate you and all your pets back there too, making their
they're running around.
debuts.
My dog loves playing with the cats and chasing them around, and then the cats will chase me.
Love to see it. Thank you so much.
You're welcome.